All right, we're going to dig deeper into this now. Again, the questions, should I get a flu shot? Is it safe if I've already gotten the COVID vaccine? To talk more about it from Miami, Florida neuroscientist Dr. Bankole Johnson is joining me to take an in-depth look to answer these questions. Dr. Johnson, hello. Thanks for coming on.
Hello, thanks for having me on your show. Looking forward to having a chat.
Absolutely, because we need to chat about the flu season. We were just listening to that report right now. The predictions that this could definitely be worse than last year when we're all shut in. What are your thoughts on that?
I think that we're looking at possibly a tridemic, an epidemic of alcohol use and drug problems and depression and mental health problems because people are closer together and isolated. We're looking at the possibility of a flu epidemic, and also on top of that we have the COVID pandemic that is still roaring forwards. So we really have a lot of health problems on our hands.
Well, yeah, that sums it up. You threw in the alcohol problems that we've seen, more drinking as people have been shut in, but they're getting out now. So I'm not sure if that will help that situation or not. But let's talk about vaccine fatigue. Some people might be just thinking, I've got my vaccine for COVID and may brush off the flu vaccine. What would you say to them?
I think you need to get your flu vaccine. The COVID vaccine is not going to protect you against the flu. And what could be a significant problem is if you have the COVID vaccine and you haven't got the flu vaccine, but then you get the flu, you then have a multitude of other complications that are hard to deal with. And in fact, the course of the flu may actually be more pervasive because there's going to be greater social isolation, and of course our hospitals are still full, and therefore the ability to get help is limited.
Right, because there's been so much emphasis on the dangers of COVID that some people may not be remembering that the flu is very, very severe. It can be.
You're quite right. In fact, the flu does kill tens of thousands of people in the United States each year, particularly the elderly. It is not as infectious as COVID-19, of course, which is probably 2 to 3 times more effective as the flu, but it is still a danger, especially to people who are immunocompromised, people, the elderly, people who have low resources or low tolerance to infectious diseases, and unfortunately people who are economically deprived, so they can't have good heating in their homes and they don't have good health care. So this could be a really big problem for people who fall in those categories.
Yeah, and we can't reiterate it enough that it is safe to get a flu vaccine and the COVID vaccine, or even a COVID booster shot at the same time, if that's where you're up to that.
You're absolutely right. It's quite safe to get both. The two vaccines do not interact with one another, and this is really great news. And why not get yourself completely protected if you've had some protection, and do this for your family and do this for the community, and best of all, do it for yourself.
Absolutely, and as we heard in that prior report, do it by the end of October, so I got to get on that one. Meantime, Doctor, I want to ask you about the new revelations that are hopeful. COVID cases are really coming down now, and there is promising news over Merck's COVID pill. How encouraged are you with these developments?
This is very encouraging news indeed, and in fact, it's the first time that we're going to have a pill that is going to help to fight COVID-19. It basically cuts down the rate of hospitalizations and deaths by 1/2. But I think it's important to listen to the message. It doesn't cut it down to 0. So whilst this might be important for people who do get COVID, whether they've been vaccinated or not, the most important preventative strategy you can take is to have a COVID vaccine. And this is only one more tool. It is not the only tool, but it's very encouraging indeed. I do have to say, one of the concerns that I have about this is that it's a lot of tablets. It's about 8 tablets a day. Most people find it very hard to take a single tablet a day, either of an antibiotic or women taking the contraceptive pill. And therefore, to have to take 8 tablets is a significant amount of tablets to take. And we're going to have to work at the compliance for people to be able to continue, who start taking, for example, the medicine, to continue to take it to the conclusion of the course.
That's another good point. We'll have to stay on top of it. Dr. Johnson, thanks so much for your time and your expertise. We appreciate it.